Informing the patient.
As with the extraoral clinical examination, the purpose of the intraoral clinical examination should be explained to the patient prior to beginning the procedure. Throughout the procedure, the hygienist should explain the structures that are being inspected and relate the procedure to any particular conditions or interests of the individual patient.
Prior to the procedure.
The examiner should remove the gloves used for the extraoral exam and perform a hand wash. The dental hygienist should hand the patient her safety glasses to wear during the intraoral exam. Place a patient napkin with the plastic side down over the patient's chest. The dental hygienist should perform another hand wash and don a new pair of operator gloves.
Patient and clinician positioning.
The operator should ask the patient to remove any appliances, partials, or dentures prior to the intraoral examination. The patient should be positioned in a supine position for the entire intraoral clinical examination. The dental hygienist will work from a seated position, and the intraoral cavity should be adequately lighted by the unit light throughout the entire intraoral exam.
The superficial inspection.
The intraoral examination should be initiated with a superficial, brief inspection of the entire oral cavity. Using a mouth mirror, the examiner briefly inspects the oral cavity for any conditions which might modify or postpone the intraoral examination procedure.
The lips.
Begin by visually inspecting the lips. At rest, the lips normally touch. If they are apart, it may indicate mouth breathing, tongue thrusting, or a number of other problems such as nasal obstruction or arthritis of the TMJ. The lip line should be noted at rest. Evaluate the vermilion border for color, texture, and fissuring. Visual inspection may reveal chapping, herpetic lesions, or other conditions.
Visual examination of the labial mucosa of the lower lip.
Next, examine the labial mucosa of the lower lip. Use the index finger of both hands to evert the lower lip. Retract the lip fully using the index fingers on the inside and the thumbs on the outside surface of the lip. It is important to retract the lip completely to obtain a clear view of the internal surface of the lip and anterior vestibule. Note changes in color, texture, or any abnormalities. Gentle pulling pressure on the lip will reveal a tension of the labial frena on the attached gingiva. A frena may exhibit tissue tags.
Palpation of the lower lip.
Palpate the lower lip beginning at the midline. Use bidigital compression to examine the lower lip for nodules, swelling, abnormalities, or tenderness.
Visual examination and palpation of the labial mucosa of the upper lip.
Examine the labial mucosa of the upper lip in a similar manner. Slide your index fingers upward so they are positioned between the maxillary arch and the upper lip. Evert the upper lip. Visually examine the labial mucosa. Palpate the upper lip between the index and middle fingers.
The mandibular aspect of the buccal mucosa.
The buccal mucosa can be retracted with the fingers to obtain a clear view. Examine each side of the mouth separately. First, stretch the tissue of the right cheek down and away from the mandibular arch. The tissue should be fully extended so that no tissue folds remain, which could conceal a soft tissue lesion. Note any changes in color, texture, or form. Fordyce's granules, leukodema, or linea alba should be noted if present.
The maxillary aspect of the buccal mucosa.
Next, stretch the tissue of the right cheek away from the maxillary arch and examine it.
Palpation of the buccal mucosa.
Palpate the buccal mucosa using the index finger intraorally to compress the tissue against the fingers of the other hand placed extraorally. Note the presence of nodules, changes in texture, or tenderness to palpation. Remember, wet fingers inside, dry fingers outside. Repeat the examination procedure on the other side of the mouth.
The Retromolar Pads.
Visually examine the retromolar pads on the right and left side. Note any abnormalities. Digitally palpate the retromolar pads. Notate abnormal tissues, textures, or pain upon palpation. An example would be edematous, keratotic, or scarred tissue from third molar extractions.
The Maxillary Tuberosities.
Now, visually inspect the maxillary tuberosities. Digitally palpate the area distal to the most posterior molars. Notate any abnormal textures or pain upon palpation.
The Parotid Glands.
The functioning of the right and left parotid glands should be evaluated separately. With the patient's mouth partially closed, locate the parotid papilla opposite the maxillary left molars. Dry the papilla with a gauze square. Press the area slightly above the papilla with an index finger or cotton swab. A drop of saliva will be evident if the duct is functioning properly. Also note the color and any inclusions in the saliva. Evaluate the parotid gland on the right side in a similar manner.
The submandibular and sublingual glands.
Have the patient tilt her chin toward her chest. Evaluate the functioning of the submandibular glands. Be sure to isolate each submandibular gland. To do this, cover one gland with gauze and expose the other gland. Blot dry the area around the caruncles and press gently downward against the gland with an index finger or cotton swab. Saliva should be evident if the ducts are functioning properly. Evaluate the left side in a similar manner.
The anterior and middle thirds of the floor of the mouth.
Have the patient tilt her chin toward her chest. Begin by visually inspecting the anterior and middle thirds of the floor of the mouth. The floor of the mouth can be viewed by having the patient lift the tongue upward so that the tip touches the hard palate. A mouth mirror may be used to reflect light into the floor of the mouth.
The posterior aspect of the floor of the mouth.
Visually inspect the posterior floor on the right side of the mouth. Grasp the tip of the tongue with a damp gauze square. and pull it to the left labial commissure to obtain a clear view of the posterior floor. Apply extraoral compression to the area of the submandibular gland on the right side underneath the chin. This will make it easier to see the posterior floor of the mouth. Repeat the procedure to inspect the floor of the mouth on the left side.
Turn towards me a little bit. Keep coming.
Palpation of the floor of the mouth.
Palpate the floor of the mouth by placing an index finger intraorally and applying compression against the fingers of the other hand positioned extraorally. When the patient's tongue is relaxed and the mouth is slightly closed, the structures will be more palpable. Palpate the entire floor, starting from the posterior and proceeding anteriorly to the opposite side. Note masses, swelling, or tenderness to palpation if present.
The ventral surface of the tongue.
The tongue is best seen with the patient's mouth wide open. Unusual tremors, shape, size, visual pattern, length of papilla, changes in color, elevations, depressions, and shape of border should be noted. The ventral, dorsal, and ventrolateral surfaces, as well as the body of the tongue, are examined. Inspect the ventral surface of the tongue by asking the patient to touch the tip of her tongue to the roof of her mouth.
The dorsal surface of the tongue.
Next, visually inspect the dorsal surface. Ask the patient to protrude her tongue slightly so that the tip of the tongue can be inspected visually. Next, use a damp gauze square to grasp and retract the tongue. Gently pull the tongue forward and inspect the dorsal surface. Be careful not to injure the lingual frenum on the incisal edges of the mandibular anterior teeth.
The ventrolateral surface of the tongue.
To examine the ventrolateral aspect of the right side of the tongue, pull it to the opposite labial commissure and evert it slightly to obtain a clear view of the lateral border and folate papilla. Visually inspect the right ventrolateral border using both direct and indirect vision. Examine the left side of the patient's mouth in a similar manner.
Palpation of the tongue.
Bidigitally palpate the entire body of the tongue. Note swellings or masses if present. Visually inspect and palpate the ventrolateral aspect on the left side of the tongue in a similar manner.
The hard and soft palate.
First, inspect the hard and soft palate visually, both directly and through the use of a mouth mirror. Using an index finger, palpate the hard palate. Palpation should be accomplished using intermittent, firm, upward pressure with an index finger.
The oropharynx.
Examine the oropharynx by placing a mouth mirror reflecting surface down on the dorsum of the tongue and depressing the tongue downward and forward as the patient says, ah.
The nasopharynx.
Examine the nasopharynx by depressing the tongue with the mouth mirror reflecting surface up, placed in the back of the oropharynx almost to the pharyngeal wall. At the completion of the intraoral clinical examination, the dental hygienist should record all findings in the patient's chart and bring them to the attention of the dentist.